Phelps, and this is my fourth video going over the ARDSnet protocol and prone positioning. So the inclusion criteria for ARDS is a PaO2/FiO2 ratio of less than or equal to 300. Your patient needs to have bilateral patchy infiltrates consistent with pulmonary edema and no clinical evidence of left atrial hypertension. So the ventilator setup for your patient with ARDS, you need to calculate their predicted body weight. Then you are able to select any ventilator mode between AC or SIMV. Then you want to set your vent settings to achieve a tidal volume equal to 8 mLs per kilo per predicted body weight, and then reduce tidal volume by 1 ml per kilo at intervals less than or equal to 2 hours until your tidal volume reaches 6 ml per kilo of predicted body weight. And then you need to set your initial rate approximate to for your baseline minute ventilation, and then adjust tidal volume and respiratory rate to achieve the pH and plateau pressure goals that I'm going to go over. So you want your pH goal to be between 7.30 and 7.45. If your pH is between 7.15 to 7.30, you need to increase your respiratory rate until your pH is greater than 7.30. If pH is less than 7.15, you need to increase your rate to 35. If your pH remains less than 7.15, your tidal volume may be increased to 1 ml per kilo until your pH reaches greater than 7.15. And for your I to E ratio, you want your inspiration to be less than the duration of expiration. And your oxygen goal, you want your PaO2 to be between 55 and 80, and then your SpO2 to be between 88 and 95, and you want to use a minimum PEEP of and for a lot of patients that I've seen at clinical, I typically see the lower PEEP and the higher FiO2. So instead of going, typically for me at least, I've seen them go more up on the FiO2 than the PEEP instead of the other way around. And here is the chart that I got off of the ARDSnet protocol. So for your plateau pressure goal, you want it less than or equal to 30 centimeters of water. And then if your plateau pressure is greater than 30, you need to decrease your tidal volume by 1 ml per kilo. The minimum is 4 mLs per kilo. If your plateau pressure is less than 25 and your tidal volume is less than 6 mLs per kilo, increase tidal volume by 1 ml per kilo until you reach that greater plateau pressure of 25 or tidal volume equal to 6 mLs per kilo. If your plateau pressure is less than 30 and breath stacking or desynchronicity occurs, you may increase your tidal volume to 1 ml per kilo increments to 7 or 8 if your plateau pressure remains less than 30.